Nashville Electric Service, and Dr. Melinda Bunton, the Mike Kerr Professor and Chair of the Department of Health Policy at Vanderbilt University, who is joining us by WebEx video conference. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I'm grateful that there have been no reports of fatalities here in Davidson County as a result of yesterday's severe thunderstorm, which happened to coincide with the 2-month anniversary of the March 3rd EF3 tornado. Our thoughts are with those who suffered injuries, and we send our heartfelt condolences to the loved ones of the Murray County firefighter who died in the storm. Utility crews have been working overnight to restore power to the approximately 130,000 customers who lost power Sunday evening. Please do not approach damaged power lines or poles and report them to the city by calling 911. I want to welcome DeCosta Jenkins, President and CEO of Nashville Electric Service, who is here to discuss the widespread power outages and how NES will respond to serve Nashville residents who find themselves in the dark as a result of yesterday's storm. Metro Public Works will continue to clear roads and sidewalks of damaged trees and debris, and as a reminder, you can contact Public Works to request debris removal on public rights-of-way by calling 311 or visiting hub.nashville.gov. Now today, Monday, May 4th, is the deadline for all Nashville residents affected by the March 3rd tornado to apply for FEMA Individual Assistance Grants and SBA Physical Property Damage Assistance. Now, FEMA has approved approximately $2.2 million in disaster grants for 697 homeowners and renters who sustained uninsured or underinsured losses. And the SBA has approved more than $9 million in disaster loans to businesses and households. If you've suffered property or economic damage from the March 3rd tornado, do not leave federal assistance on the table. Apply today at disasterassistance.gov. Again, the website for FEMA and SBA applications is disasterassistance.gov, and the deadline is today, Monday, May 4th. Our public health department is working quickly to address clusters in Davidson County in order to slow the spread of the coronavirus, and Dr. Alex Jahanger will discuss these cases in more detail momentarily. I urge everyone to continue following the Safer at Home order by staying at home whenever possible and only running essential errands. Public Health Order number 4 is also in effect, so remember to wear a face covering anytime you're out in public to protect yourself and those around you. Now, I know that all Nashvillians are anxious to safely return to business as usual, and many livelihoods depend on it. But a balanced approach today can further mitigate the spread of the coronavirus, help save lives, and prevent a false start of our economic reopening. Public health experts uniformly agree that each additional day we observe our safer at home protocols will increase the likelihood of more swiftly and successfully moving through subsequent phases of our roadmap for reopening Nashville. We are closely monitoring the benchmarks required to begin phase 1 of our roadmap and will continue to report on these metrics every morning. As a reminder, we've also published several important public health metrics online in the interest of full transparency, and you can visit covid.nashville.gov to review the Metro COVID-19 dashboard, which includes our coronavirus transmission rate, the 14-day new case trend, the ability to conduct countywide contact tracing investigations, COVID-19 testing capability, and our local hospital capacity. This morning, I want to welcome Dr. Melinda Bunton, the Mike Kerr Professor and Chair of Health Policy at the Vanderbilt University School of Medicine. Dr. Bunton and her team at Vanderbilt have been our partners since the beginning of our citywide COVID-19 response, and we're grateful to have her Join us this morning to discuss the importance of a measured approach to our economic reopening strategy and to take questions. I'm thankful for the hard work of everyone on the front lines of our coronavirus response, and today I would especially like to recognize the efforts of first responders and public safety officers at the Metro Nashville Police Department. Late last week, we received a message from the grandmother of an Ohio man who was helped by Officer Steve Fouché of Metro's West Precinct. Officer Fouché came to the aid of this young man who was heading home from a railroad construction job in Alabama when his car broke down. The officer stayed with the traveler until his disabled vehicle was safely off the roadway, and he even paid for the citizen's towing expense out of his own pocket. And then earlier this week, Sergeant Scott Carter, a 22-year veteran of the Metro Police Department, was featured as one of People magazine's COVID-19 Everyday Heroes, and said despite the demanding nature of the job, he simply couldn't imagine doing anything else. We are truly fortunate for individuals like Sergeant Carter and Officer Fouché. Their stories are just two examples of the everyday heroism and sacrifice in the Metro Nashville Police Department and throughout our first responder community. We're grateful for their service, especially during these uncertain times. And as always, I urge you to visit Metro's COVID-19 website, where you can make a contribution to the COVID-19 Response Fund or learn how to obtain direct financial, food, mental health, and social service assistance. And I'd like to turn it over now to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 3,191 confirmed cases with 27 fatalities. That is an increase of 165 cases in the last 24 hours. Of the Davidson County cases, 1,548 are currently active, and 1,616 residents have recovered and have become clear. Now, since our update on Friday, we have had an increase of 359 new cases. However, included in this total are some new cases that are linked to isolated clusters. We are still evaluating the number of new cases that are part of these clusters and the ones attributed to general community spread. Now, we continue to analyze the information to determine the actual impact of the community spread of the virus, which will most likely be significantly lower than what the 359 new cases indicate. A couple of clusters are positive cases from the homeless shelters at the Fairgrounds and at the Nashville Rescue Mission. After 4 individuals tested positive at the Fairgrounds facility last week, we began a comprehensive contact tracing investigation. This led to testing of all the individuals at the Fairgrounds and at the Nashville Rescue Mission. 206 people at the Fairgrounds were negative and 19 were positive. 395 individuals were tested at the Rescue Mission, and of those individuals, 100 were positive, 9 were indeterminate, 12 are still pending, and 274 were negative. One of the positive cases from the mission needed hospitalization, and they are receiving the care they need currently. The others who did not require hospitalizations are now housed at the fairground facilities. This is a separate building from the one used for housing residents who are well. It's set up so these residents can self-isolate in a safe place. We've also increased medical personnel at the Fairgrounds facility, and our protocols are in line with CDC guidelines. I visited the facility yesterday to ensure that we are doing all we can for these vulnerable Nashvillians. We planned for incidents like this when we first opened this facility, and our plan is working out as expected. Now, I want to thank the team at the Office of Emergency Management, the Metro Public Health Department, the Metro Department of Social Services, the volunteers, and the staff at the Nashville Rescue Mission. They quickly activated and worked together to respond. Their quick action helped us contain the spread of the virus, but more importantly, they saved lives. Now, last night's storms did damage the tents at our community assessment centers, but crews immediately responded, and all 3 sites are open this morning. The centers are at Nissan Stadium, Meharry Medical College, and at the old Kmart location in Antioch. As you may remember, these sites will now be open 5 days a week, Monday through Friday, from 9 a.m. to 3 p.m. This has expanded the testing in our city, giving residents easy access to free testing which is a service we need to have in place as we move forward towards reopening. In fact, last week, our community assessment centers tested nearly 2,500 Nashvillians, and this, combined with other efforts to test individuals throughout our city, resulted in over 6,000 Nashvillians receiving tests last week alone. Now, the storms have resulted in power outages that have affected our assessment hotline, and we're still working hard to get this back online. So if you think you have the virus, if you think you've been exposed to the virus, or if you're worried about the virus, please go to one of our community assessment centers today. You will be assessed and tested by a medical professional. But as noted, our hotline is currently not operational, and we will get it up very soon. Now, every morning during these press conferences, the mayor and I urge and encourage you to do your part. And you have responded in Nashville in a big way. Just a few weeks ago, we were planning for a 1,000-bed auxiliary hospital because models would show that our hospitals would be overrun. But you stayed at home and you flattened the curve in our city. And now we need you to do this for just a little bit longer. Focus on staying at home, wear your face coverings, keep your distance, and help friends and family who are most vulnerable. Thank you all for what you're doing. We're getting through this together. I now would like to introduce Mr. DeCosta Jenkins, President and CEO of Nashville Electric Service.
The severe storms hit Middle Tennessee yesterday fast and furiously and caused the largest number of power outages in my 29-year career at NES. Straight line winds as high as 60 to 80 miles per hour knocked out power lines, downed trees, and interrupted power to more than 130,000 customers. By comparison, the March 3rd tornado left 50,000 without power. The outage is widespread and large-scale and will take some time to get all power restored. We had all available crews working all night last night. We were able to restore power to some 30,000 last night. We brought in some 43 contract crews, and we've got more contract crews coming from Ohio. We want you to know that the safety of our customers and our crews are a top priority, and we will be taking safety precautions related to the COVID-19 to make sure that even in restoring power at this time, we are, to the extent possible, practicing safe social distancing. We ask everyone's patience as we work around the clock to make repairs, especially since more storms could be coming overnight. Restoration time, as I explained during the tornado, depends on individual circumstances. In some cases, power could be out for 2 weeks. I think with the tornado in the worst case, it was 8 days. But again, it was 50,000 then, it's 125,000 now. We realize that this is an unfortunate timing on the heels of the tornadoes we deal with combating this COVID-19 virus. We're very empathetic to our customers that are impacted, and we want to make sure that we do everything in our power to get power back on as quickly as possible. Thank you.
Thank you, Mr. Jenkins. I'd now like to introduce Dr. Melinda Bunton, the Mike Kerr Professor and Chair of the Department of Health Policy at Vanderbilt University, who is joining us by WebEx video conference.
Good morning, and thank you for inviting me to speak today about the spread of COVID-19 in our community. My name is Melinda Bunton, and I'm chair of the Department of Health Policy at Vanderbilt. I'm part of a team of researchers looking at data about COVID-19 cases across Tennessee, and our goal is to present useful metrics and illustrative scenarios to aid decision-making. While Nashville's plan, like most others around the world, appropriately looks at a number of indicators, one of the key things that informs policy responses around an epidemic is whether the number of cases is growing, stable, or shrinking. The best way to understand the trajectory of cases, in our opinion, is to look at the number of new cases over a period of time. This chart on the screen shows the number of new cases reported in Davidson County over the period from the middle of March through yesterday, arranged by the day on which the person was tested. The gray jagged line shows the pattern in the number of tests administered on that day that came back positive, in other words, the new cases, and you can see it goes up and down a lot. Part of that is because the number of tests administered varies day by day. Generally, you see a dip every weekend. For example, April 12th was Easter Sunday, and not many people got tested. You also see a spiky Monday, Wednesday, Friday pattern that's likely due to the citywide testing centers. So if you look at the data, though, by date reported, meaning the date when the lab got time to run the test, it looks even more up and down. So we like to look at the date the person got tested. Now, with this much variation, how do we know if things are getting better or worse? The easiest way to do that is to look at an average over a period of time, like a week or 14 days. Doing it over a week, as I did on this chart, means that you won't be fooled by a low day only because fewer people are getting tested on the weekend. The smooth blue curve you see on the chart shows the average on each day over the prior week. As you can see, unfortunately, we're still seeing our number of new cases growing. So what can we do about this? Well, 2 weeks ago, my team looked at some scenarios about what might happen if Tennessee's safer at home order was lifted on May 1st versus waiting until May 15th or June 1st. One important point made in that report is that the time Tennesseans had stayed home really had paid off. The growth in new cases across the state was flattening out. And that happened even though day-to-day numbers fluctuated. We also showed how staying at home a little longer could further drive down that average number of new infections and decrease the likelihood that the virus would spread so quickly it might overwhelm our healthcare system and have all of us return to safer at-home practices. None of us wants to see that happen. So where are we today? Given that the statewide order was lifted just last week and that rates of testing have increased, it's difficult to predict the future at this moment. I think Nashville should be sure that it has the public health infrastructure, sound guidance for businesses about safe reopening, and testing capacity in place before moving to phase 1 of its plan. And I was happy to hear some updates about that just now. And finally, I do hope that all of us can continue to stay safer at home, put Nashville in the best position possible to withstand the worst of this pandemic as we reopen our economy. Thank you for having me.
Thank you, Dr. Bunton. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Jeremy Finley at WSMV. Jeremy.
Good morning, everybody. Thanks again for answering our questions. I have 2 questions. One, I wanted to just verify, at the Fairgrounds right now, how many positive cases do you have at the Fairgrounds location for COVID-19 cases? And then the second question has to do for NES. For the people that are listening to this, can you give them some kind of time frame of how long you would, if you were one of these people, how long you would plan, how long they should plan to be without power, and which areas you are concentrating on as of today to try to restore power, because I'm assuming it's the largest outlet. So thank you.
Thank you, Jeremy. We'll start with the Fairgrounds question, and Dr. Jahangir.
There are currently 115 individuals in the Fairgrounds side for patients, for individuals who have COVID. And Mr. Jenkins.
So I think to be safe, I would plan on at least a week. As I explained, we got 30,000 up last night, and we'll get 30 to 60,000 up today. But again, this is not like the tornado where I had only 4 sections where I could focus my crews in those sections. This is a widespread outage. And so we've got crews throughout the system because I can't prioritize one section of town over the other. So we've got crews in all parts of the city working 24/7, 14 hours a day until this thing ends.
Stephen Elliott at the Nashville scene.
Hi, thanks. One metric the state has cited is the decline of flu-like and COVID-like symptoms at almost every hospital in the state, they said. Is that something that you've been tracking here, and how the hospitals fared?
Dr. Jahangir.
We have been tracking how, in gist of it, how people how many people are presenting with COVID symptoms at hospitals, as I've mentioned many times before. Every morning, including this morning, I've communicated with every hospital. It has been stable this whole time. I don't have a upward or downward trend, but it seems to be stable right now. Thank you.
Harriet Wallace at Fox 17. Go ahead, Harriet.
Hey there. Good morning, everyone. This message is, this question is in regards to the fairgrounds and the cases there. I understand that some people tested positive, did not present with symptoms, which would mean that they were in general population, I would imagine, and those who are assisting them working the shelter were not aware. Also, last week, I learned that only those who are assisting those who have known to test positive are provided with protective gear. My question is, what is being done about those who are working the shelter, who were exposed to people with the virus but did not know it? What happens to them at this point with regards to their care and their safety? Thank you.
Thank you, Harriet. Dr. Jahangir.
So, Harriet, as I mentioned, I went to the fairgrounds yesterday. You may have some insight on fairgrounds as well, and I just want to let you know that to my everyone who has been, you're right. There were some asymptomatic people that initially, I believe 4 initially asymptomatic people that presented to the shelter. The moment they've shown signs, they were tested. Then the contact tracing found a circle of people around them tested, and then the decision was made to test everyone, including staff. And those people were all tested, and anyone that was positive was taken to the other side of the shelter for the ill people. The general precautions on the well side are just basic masks, not necessarily N95 masks, because again, these are well individuals. But if you are on the ill side, there are more higher level of protective equipment, PPE and so forth that is made. But to answer your questions, yes, initially they were asymptomatic. There was no reason to suspect they had anything, but the moment symptoms showed, obviously precautions were taken. And thank you.
Blake Farmer at WPLN. Blake, you're on the air.
Yes, this question is for Dr. Bunton, though Dr. Jahangir may want to jump in. This issue of trying to model where things are heading when you also have these isolated outbreaks. We've certainly heard from the state that they're sort of tossing out, outbreaks at prisons and not in the general population. But as you all do the modeling, does that really matter? Can you really, just not consider those isolated outbreaks and just look at general population?
Dr. Bunton?
So it is certainly true that these outbreaks make modeling very tricky. In places where people live in close quarters, the virus can spread very rapidly, more rapidly than it might spread in other settings. However, I hesitate to call them isolated because, of course, these facilities all have staff who go home to their families, go to grocery stores and things like that. And so that's why it's so important to take public health measures and track where those individuals go and the people they may have been in contact with, so that those people can isolate or quarantine as appropriate. But yes, it makes modeling very tricky, and we are thinking about that all the time as we think about how to recalibrate our models given these large jumps due to facility outbreaks.
Thank you, Dr. Bunton. Our final question today is from Ian Jong at the Tennessean. Ian?
Good morning. I wanted to know if there were any conversations about ending congregation of sheltering at the fairgrounds and maybe moving some of the community members into maybe temporary use of hotels or other facilities around the city.
Dr. Jahangir?
Thank you for the question. Welcome back. So I want to be very clear. This is not congregation housing. The fairgrounds is just together over 100,000 square feet of facility. Follow CDC guidelines, and people are spread apart. The ill side has partitions between each individual thing. There are a lot of resources of people, of other resources that are given to the place. So right now, our plan for the majority of our unhoused individuals is working well and makes sense as part of CDC guidelines. So as of right now, there's not a plan to do a mass move everyone out of the 100,000 plus square feet area that we've set up per CDC and public health guidelines and move them to hotels. So no, thank you.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank DeCosta Jenkins and Dr.
All right, you have been listening to Mayor Cooper and other Metro officials with the very latest. And a quick recap of some of the numbers. We do know there's now a total of 3,191 confirmed cases. Again, that's Davidson County alone. And here's the big jump that everybody's talking about. That's the increase of 165 cases in just the last 24 hours. One of the big questions we know, our Jeremy Finley was asking this, and that's a time frame. They were addressing NES and our power outage. It was above 130,000 at the height of the storm. Now they're saying it's still at about 125,000. And the question was, how long should people plan to be without power, and which areas will they be concentrating on? And what we heard from NES's president say was they should plan on at least a week, which is obviously not what people want to hear. But he says they'll have crews in all parts of the city 24/7, working 14 hours a day until all power is restored. We'll, of course, continue to follow this, bring you the very latest. I hope you'll join me for News 4 at noon for the very latest with all this information as we break it down for you. You can also find more online at WSMV.com and on this News 4 app. Just search WSMV. Hope to see you at noon.
We now return to regular programming. Get more updates at WSMV.com and on the WSMV app.
Bart Durham Injury Law. We are open 24/7. Our team is working remotely so that we can stay connected during these times. We can get to work for you without a face-to-face meeting. We will get through this together.